Good afternoon. My name is Lindsay Roberts, and I'm going to be presenting on Graves' disease today. Graves' disease is an autoimmune condition that is systemic in nature and essentially causes hypersecretion of thyroid hormone. Now, this hormone is responsible for controlling growth, metabolism, hormone balance, but it also serves the purpose of moderating other functions of the body like heart rate and temperature regulation. Now, this condition occurs when your immune system is actually starting to attack your thyroid. So basically, the body creates an antibody made by your immune system called thyrotropin receptor antibody. This antibody takes over the pituitary gland, and this gland is responsible for controlling the thyroid and its secretion of its hormone. Now, when the antibody takes over, the thyroid oversecretes, and this causes systemic symptoms, which we'll go over momentarily. This condition is prominently hereditary, about 80%, 20% due to environmental factors. Now, there are a whole slew of symptoms that are associated with Graves' disease, and they can impact so many different systems of the body. The symptom that I feel like you hear about most with this condition, I mean, there's commercials on TV called exophthalmos. So this symptom is something that occurs when there's swelling behind the eyeballs, and this causes the eyeball to bulge, and makes it seem like the patient has a very wide-eyed facial expression because of the swelling that's occurring. Other eye symptoms, a lot of patients feel like they have grit in their eye, some pressure in the eye. There's inflammation, photophobia, which is light sensitivity. Some people even experience vision loss and double vision or diplopia. Some other kind of generalized symptoms that people report: fatigue, heat intolerance, an irregular heart rate or tachycardia, impotence, unexplained weight loss. There are gastrointestinal symptoms, including irregular bowel movements. And then an interesting symptom that I wasn't aware of, it's called Graves' dermopathy. And this occurs on the feet and shins and causes thick, discolored skin. So, like I said, it is an autoimmune disease, and a lot of times autoimmune diseases impact a lot of different organ systems and systems of the body. Now, when we think about treatment for Graves' disease, there's a couple of different diagnostic assessment tools that are used. The first being RAIU, which is that iodine uptake test, where we look at how the thyroid responds to iodine, Doppler ultrasound, and then there's some blood testing and antibody testing too to identify whether this specific antibody is attacking the thyroid. So once that testing is done, an endocrinologist can diagnose some things to monitor to alleviate the symptoms. A lot of times beta blockers are prescribed to treat the cardiovascular symptoms like tachycardia. Antithyroid meds help moderate hormone production and lower that oversecretion. Another option is radioiodine therapy. Now, this serves to destroy the gland cells of the thyroid, and essentially this does lower hormone secretion. And I would say most intensively, a thyroidectomy is an option, which would be completed by an otolaryngologist, and that is complete excision of the thyroid gland. Thank you for watching.